examining the patient, while treating the patient, he may be negligent and may not have followed the procedure what a normal doctor should do. And in his negligence, he misdiagnoses the disease because he has not followed the proper procedure, or because he was in a hurry, or because he was lazy, and in this case, the patient dies. Now, in this scenario, it is not a major sin because he is a qualified doctor and he is experienced. It was negligence, but he is responsible for the death. There is no qisas, but there is diya money. He will have to pay the blood money to the relatives, to the inheritors of the person who has died. And he will have to fast for 2 consecutive months, for 60 days. In the third case scenario, there is a qualified and an experienced doctor. He follows the normal procedure what a doctor should do. He follows the methodology, but because of human error, he misdiagnoses. There's no negligence on his part, but he misdiagnoses, and there can be human error. No human being is always 100% perfect. So in this case, because it's a human error and he has followed all the proper procedure which a doctor should do, and then if he misdiagnoses, there is no sin on him. He does not have to pay any kafara. He does not have to give any diya money. He was doing his profession and it was a human error. So in this case, he is not liable or he is not responsible. As long as he took proper care, he didn't do it purposely, it was a normal human error. In the third case, it is not a sin, neither does he have to pay kafara, neither does he have to give diya money, he doesn't have to fast. As what you explained in your question, that a year back, a 24-year-old Muslim male comes with epigastric pain and with chest pain, and you diagnosed it as GERD, gastroesophageal reflux disorder. And next day he died. You are suspecting it may be a cardiac disorder. You don't know about it. You're assuming because he died. So in this case, I wouldn't call it negligence. I would call it misdiagnosis. And this is common. I'm being a medical doctor. Many a times the cardiac patient, the symptoms shown by a patient of GERD, gastroesophageal reflux disorder, is quite similar to a patient of cardiac symptoms, heart problems. So in this case, it happens many a times that the doctor misdiagnoses. It does happen. So in this case, I would not call it negligence, and you have not done any sin. You don't have to pay any diya money, neither do you have to fast from that.